I think it's time. Good afternoon, everyone, and thank you for joining us. My name is Latifa Lashimi from the STAR IDAZ International Research Consortium Secretariat, and I'm really happy to welcome you to this first session of the STAR IDAZ Innovation Academy 2025. We created this webinar series with one simple goal, is to support our global community of researchers, funders, and policymakers in moving from discovery to delivery. And to do that, we built this series around three very practical themes that connect the whole innovation pathway. Today, we are starting with the STAR IDAZ research roadmaps, and these roadmaps highlight the most important scientific need and help guide collaboration and investment. They are a tool many of you maybe already use in your work, and today Gary will take us a bit deep into how they can support planning, alignment, and impact across the animal health research community. Our second session will be on the 3rd of December, of course, the second session of this series of webinar in the afternoon at 4 Central European Time with Dr. Johannes Charlier, and he will focus on discount tools, a very practical tool to identify research gaps and to support writing better targeted proposals. Many funders also look at discount tools when defining priorities, so this session should be very useful for both researchers and people involved in research planning. And finally, on the 17th of December, as you see on the poster, at 4 p.m. Central Europe time as well, we look at how to bridge the gap between early stage research and industry uptake. This session will be led by Dr. Sven Arnott, and he will walk us through the steps and partnerships that help move ideas closer to real-world innovation. This is often one of the most challenging parts of research and innovation linkage. The three sessions are meant for everyone involved in animal health research, whether you are early career or advanced or working in funder or policy. The idea is to give all of us practical tools and perspectives that can support innovation and make our work more impactful. And with that, I'm very pleased to introduce today's speaker, Professor Gary Entrikan. Gary is honorary professor at the Roslin Institute at the University of Edinburgh, and he has dedicated his career to understanding immune responses in farmed ruminants and developing new approaches to disease control. He has contributed to more than 100 scientific publications and has played a major role in the development of several STAR IDAZ roadmaps. I would also like to acknowledge Dr. Jeremy Salt from the STAR IDAZ Scientific Committee and the CEO of Vaccine Development, who is joining us today and will contribute to the discussion during the Q&A session. Gary will speak for around 40 minutes, and then we'll open the floor for questions for about 15 minutes. So please feel free to type your questions in the Q&A box at any time. Gary, thank you again for being with us, and the floor is yours. You can share your slides.
Thanks, Latifa. If you can just tell me if you can see my screen. I'm just going to share. And can you see my presentation?
Not yet, Gary.
Okay, let me come back out of that. Okay, let's try again. Can you see anything now?
Nope, not yet.
Okay. Now, can you see it?
No.
Hold on a second.
Yeah, it's coming.
It's
Yes.
coming. Right.
Good. Yeah, thank you, Gary.
Right. Great. Okay. 1 second. So wait a minute, let's jump back. 1 second. Right. We should be good. Yeah.
Yes.
Perfect.
We are
And
good.
Latifa,
Yeah.
can I check? Can you see my pointer moving on the screen?
Yes, very well. Yeah, I see it.
Excellent. Right. Sorry for that technical hitch. Okay, Latifa, thank you very much for the introduction. So as Latifa said, I'm going to talk about the STAR IDAZ roadmaps and their value to stimulate collaboration and maximise the return of investment in animal health research funding. I could probably start this by way of a summary, and I think the key elements that I hope come through during this webinar are collaboration, coordination, and integration. Those are the key elements that we need for identifying research gaps and also to reduce duplication of effort so that we can maximise the return of investment in animal health research funding. And what I would say is that this isn't simply the responsibility of funders, it is the responsibility of all of the global research community. What we have to do is find mechanisms by which we can do that. And hopefully throughout this webinar, you'll see where I think the STAR IDAZ roadmaps can contribute to that. So this is the structure of the webinar. I'll talk about some background to STAR IDAZ International Research Consortium, why we need to have improved coordination for our global research in animal diseases and zoonoses. I'll then talk about the principles of how the STAR IDAZ research roadmaps were developed and then how they can be applied. And I'll use an exemplar of one of the priority diseases for STAR IDAZ. And then, as Latifa said, we'll go to a Q&A, and I'm really delighted that Jeremy will be part of that. He's the CEO of the vaccine group, and also me, a fellow member of the STAR IDAZ International Research Consortium. So looking at the purpose and structure of STAR IDAZ IRC, for those of you that might not be aware of it. So the purpose is to coordinate animal health research globally to accelerate delivery of control tools for diseases of importance for animals and zoonoses. You can find all of the information that I'm talking about on the STAR IDAZ website, but this is the general structure or the organizational structure of STAR IDAZ. You'll see that it is global. There are 36 partner organizations across 23 countries. There are 4 regional networks and that cover 55 countries. And there is around or just over $2.5 billion of investment in research by those different partner organizations. I think it's worthwhile highlighting at the moment, this is not new research money that STAR IDAZ provides as a sort of in response to requests for funding. This funding is allocated by the funders that have a stake in animal health and zoonoses. In terms of the organisational structure, there's the International Research Consortium, the Executive Committee, which is largely the funders, the Scientific Committee, which will provide advice to the Executive Committee on priorities. We have working groups, and I'll explain in more detail how those working groups operate in terms of the gap analyses and the roadmaps. I've mentioned those regional networks, which will look at priorities for those specific regions, and the Secretariat, which Latifa is a member of, which overlooks the organisation of STAR IDAZ. So Latifa mentioned this about the how we deliver on our objectives. And this is through coordination of animal health research globally. This covers basic research, translational research, and applied research through this pipeline to develop the countermeasures for disease control. So diagnostics, vaccines, therapeutics, and also knowledge that's important that goes into all of those combined efforts in terms of managing animal health and disease globally. There are a number of STAR IDAZ priority topics. So here I've listed the diseases and infections. Again, you can find this on the STAR IDAZ website. And then, quite importantly, there are a number of cross-cutting topics that underpin these diseases and infections to differing extents. So things like diagnostics and vaccinology will cover all, if not most, if not all, of these diseases and infections. Some will cover part of them, such as the vectors and antimicrobial resistance. But these topics are very important for providing the framework as to how we tackle the diseases and infections. So moving on to the second part of the presentation, which is why do we need to have improved coordination for global research in animal diseases and zoonoses? So here I've just taken an image from a report, again, which you can find on the STAR IDAZ website. So this is a report on One Health approaches to research, and this was from a meeting that was held in Nairobi 12th and 13th of March in 2025. And the figure here refers to the channels and mechanisms for funding, which looking at implementing the One Health Joint Plan of Action, which is adopted by the World Health Organization and WOA. And you can see here there are multiple stakeholders that are involved in supporting and delivering research into One Health. And I think one of the interesting things that you'll find in this report is looking at barriers. And it will, I think, come as no surprise that one of the barriers that was identified is that there is limited collaboration between funders of complementary projects or synergistic projects globally. And identifying these is one thing, that particularly because we don't have kind of good databases on this, but it's about then finding the mechanisms by which we can overcome these barriers and improve our efforts in One Health. And one of these is about regular dialogue. So I mentioned coordination at the start. There is definitely a need for greater coordination and collaboration between different funders to try and address this. One solution might be something like a global tracker of One Health. But again, I recognise that there are challenges within this, although the pandemic has certainly taught us quite a lot about how we can collaborate much better when there is strong will and momentum behind that to deliver solutions. And we saw that particularly through the COVID-19 pandemic and the development of vaccines that got us out of the lockdowns. So in terms of realising the impact from the research that Latifa mentioned, this is something that STAR IDAZ partners do recognise the importance of in terms of the global coordination. And again, I would point you towards the recent annual State of the Art report for animal health research priorities. This was just published last week by STAR IDAZ. You can find it at this hyperlink here. And as I said, the cross-cutting topics are crucial in delivering that impact and implementing the research for the deliverables for the priority diseases. And the examples that I'm going to show you in terms of the cross-cutting themes come from vaccinology and diagnostics. And again, I'll mention quite a lot through this webinar, but expert opinion is very important in terms of guiding the priorities for STAR IDAZ, and these come from multiple stakeholders. So looking at the first of these, vaccinology, and this is from the STAR IDAZ website. What you'll see if you go onto this part of the website is information of various stakeholders and resources that contribute to the STAR IDAZ approach. So, for example, the International Veterinary Vaccinology Network is very important, the Immunological Toolbox, providing capability, and the World Organization for Animal Health for the Manual for Diagnostic Tests and Vaccines. So these are all resources and facilities that support the type of approaches that STAR IDAZ takes. And this is a very important landscape survey report that was published in January 2022. This was conducted on behalf of STAR IDAZ by BBSRC and involved a number of partners, so not just the International Veterinary Vaccinology Network, but also learned societies such as the British Society for Immunology, the International Union of Immunological Societies, and the American Association of Veterinary Immunologists, as well as funders. And this is a very, as I said, a very impactful report because it has underpinned some recent funding initiatives. And a number of conclusions that came from this was that there does need to be sustainable and open access to immunological tools and associated databases, hence the Immunological Toolbox. But partnership with industry is key. And I just want to highlight this because I think we do need to be very much aware that we should be engaging with industry in vaccine research from a very early stage of that research, because it will help guide the direction of travel and what that vaccine is going to look like in the longer term coming from the basic research. The other element that I mentioned was diagnostics, and again, this is a report that was published 2 months ago, looking at gaps and opportunities in animal health diagnostics by STAR IDAZ. And the figure that I just want to pull out here, again, it relates to the points that we're talking about today, which is challenges in terms of delivering on diagnostics. And you can see here that data figures right at the top. And this is really about data management issues such as integration, processing, transparency, how we manage these in light of confidentiality and how and ownership of these data, but finding ways around this so that we can share our knowledge and get better diagnostic tests for the diseases that we are working on. And of course, diagnostics and vaccines do not sit in isolation, and the exemplar that I'm going to use from the roadmaps will demonstrate that quite nicely. So moving on to underlying principles of the STAR IDAZ research roadmaps. These roadmaps are really a framework for strategic research, and they do tie very strongly into these elements of collaboration, coordination, integration, and gap analyses, and particularly for finding ways to reduce the duplication of effort so that we do generate that return of investment as best we can. This is a publication from 2020, which you can look at. Again, this was supported by STAR IDAZ, and this publication describes how we constructed those genetic roadmaps, so for vaccinology, for diagnostics, for therapeutics, and for disease control, and how these would then map onto, or how the diseases, the priority diseases, would map onto these generic roadmaps. So I won't go into this in too much detail because you can read a lot of the detail in the paper, but a number of things that are mentioned in this paper that I'm going to talk about a bit more in detail are things like the target product profile and how we use that effectively in our research. So the purpose of those roadmaps, as I said, was to provide a common template that could be used for vaccine research that then can be adopted for different diseases. And of course, there'll be different needs for these different priority diseases, depending on where they are within that roadmap. The pipeline in the roadmap has a series of nodes, as you'll see, and these nodes will represent key elements that are essential for progression to the desired endpoint. And in the case of vaccines, what we're looking for would be a vaccine that will be deployable by end users and will be effective in combating the disease in question. And it's crucial to keep this in mind because it does relate very clearly towards the target product profile. We're looking for a vaccine, for vaccines that will be used and effective in the correct setting. So this is a schematic of what the generic research roadmap for veterinary vaccinology would look like. So this is a template that we came up with. And thinking about the vaccine and what that vaccine could look like, so this could be an attenuated, naturally attenuated or rationally attenuated vaccine, could be inactivated, it could be nucleic acid, could be subunit, it could be a vectored vaccine. So multiple different types of vaccines, and within these, obviously, there are elements of safety, efficacy, how these would be measured. But the way these roadmaps work is that if we pick what type of vaccine we're thinking about developing, so for example, if we use rationally attenuated candidates, we then start to work back and look at the dependencies. So for the rationally attenuated candidates, we're looking at attenuated organisms. To make these rationally, we need to know about the virulence factors. Are there immunomodulators within those organisms? And what is the host response to infection? And breaking this down a bit more, we need to understand more about host pathogen interactions, the entry, replication, are there elements of persistence that might impact on that? And this ultimately will take us back to knowledge of the pathogen genome. So it's about finding where we are in this roadmap and looking at the dependencies that allow us to take us to the next step and then get to that vaccine, which is the ultimate goal. So I mentioned that there are lead areas under each node. So if you go into a node, and again, I'll show you an example of this later, there would be the research question. So what is it we're trying to achieve with this particular part of research? What's the problem we're trying to solve? What knowledge gaps are needing to be addressed, and what are the challenges that we're going to face in doing that? What are the solution routes to address that research question? And as I said, dependencies. So what else needs to be done before we can solve this need? Do we have the capability? Do we have the knowledge that we can address the question, or do we need to go back further and look in more detail at an element that feeds into this? And crucially, and for looking at our return of investment, what is the state of the art? What existing knowledge is there, including successes and failures? And for failures are really important. This is where knowledge sharing comes in. Failures don't always get published, but communication is important. How do we capture that? Because we certainly don't want to keep making the same mistakes. And this also links into projects. What activities are planned or underway? So what projects are already funded? This is quite complex, and obviously it does require input, as I said, from a number of stakeholders, including researchers, because we need to try and get this knowledge as best we can from the research community. So the method of applying these roadmaps and looking at the generic roadmap for vaccinology as an example, so defining the goal. What does that deployable vaccine look like for an end user for the disease that we're looking at in question? And we then take an informed approach to defining that goal. We need to engage with end users to know what it is they want. We need to engage with industry and regulators at an early stage of research to make sure that that vaccine is actually going to be deployable and it's going to meet those needs. And then, as I said, we work through the nodes in that research pipeline and we identify the gaps in the knowledge and capability that need to be addressed. So this is where the funding would be directed at addressing these gaps so that we ultimately get to that vaccine. I think it's quite useful at this stage to talk about some key definitions for vaccinology research, having mentioned multiple stakeholders and particularly talking about engagement with industry. Because I think certainly from our discussions at STAR IDAZ IRC, we are aware that people may have different interpretations or different awareness of these different terminologies. So here, when I'm talking about a target product profile, and I'll show you again a template of how we can do this, it's about defining the acceptable and non-acceptable features of a deployable vaccine. And this covers a number of things. So this is not just about the science, it's about the cost, it's about the quality, duration of immunity, the number of immunizations that would be required. Does it have to be linked to a diagnostic test? So should this be DIVA? The other thing that we talk about is technology readiness levels, and some funders may request that a project is at a particular technology research level. And these are on a scale of 1 to 9 with a set of specific milestones. So TRL1 would be about establishing the scientific principle in question. Moving up to something like 3 would be looking at immunogenicity of that vaccine in target species. Moving up to 7, where we're getting much more towards the end of the deployment, would be looking at safety and efficacy in field conditions. Proof of principle and proof of concept, again, I think are two things that can often get conflated. So proof of principle is about establishing the validity of the fundamental science that underpins that research into the development of the new vaccine, whereas proof of concept is establishing that the idea can be turned into a practical vaccine. And this is about demonstrating feasibility and activity in vivo studies, again, with consideration for the final commercialization process. So practical elements like seed production, can it be scaled up? What is the cost of goods? And you can see when you think about the proof of principle and the proof of concept, these will sit at different points in the TRL scale, with the proof of principle lower down, the proof of concept being higher up. So I mentioned about target product profiles there, and that these provide a focus and direction of travel for the vaccine research roadmap. And when thinking about or formulating a TPP, it really should be addressing an unmet need for those stakeholders, and it should be something that should be reviewed as research progresses, because it can take several years to get from the point of research to that target product profile goal. And I think that review element and that perspective is really quite important, because I know that researchers can sometimes be nervous about feeling that they tie themselves to a target product profile at an early stage of research, because it might be looking to set themselves up for failure. And it's not that. It's about thinking what in general that vaccine is going to look like, but then getting, as I said, the direction of travel and the framework. So here, this is a table that gives an example of a target product profile for an anti-methanogen vaccine. So this table was constructed by Paul Wood, who was co-author of this paper looking at platform technologies for novel veterinary bacterial vaccines. And this came out of a workshop, again, that was supported by STAR IDAZ at the 2023 International Veterinary Immunology Symposium at Kruger in South Africa. And the things I just want to point out to you in terms of this table are looking at the attributes of the vaccine when you're thinking about a TPP. So the profile, what's the base profile? So here, for example, if it's an inactivated vaccine that reduces methanogens without negatively affecting productivity. Because it's an inactivated vaccine, then differentiation means that it will require an adjuvant that will stimulate duration of immunity. Then thinking about the variables. So what are the benefits? The benefits are that reduce methane emissions. What are the risks? Well, would that vaccine increase susceptibility to other diseases? And then thinking about things like the unacceptable profile, things like would the production cost be so high that this would not be feasible for end users? And I think this column is the thing that we sometimes can overlook in science, particularly at very basic areas of research. So it's about thinking where that research is ultimately going to take us so that we will ultimately get the kind of product that we are looking for. But as I said, the target product profile, it's a direction of travel. It gives us a framework. It's not something that should be fixed, and it may change in light of new research that comes out while current research is ongoing. So the final part I want to talk about is the roadmaps in action and looking at strategic vaccine development for a priority disease. So going back to the priority topics, the slide that I showed earlier, looking at diseases, infections, and those cross-cutting topics. So the exemplar that I'm going to use is bovine tuberculosis here, and thinking specifically about vaccines and tools. So we'll be looking at how we would adopt vaccines as a control for bovine tuberculosis. So this is, again, going into the STAR IDAZ website and going into the disease section, the priority topics here. And what you'll see is the STAR IDAZ approach, descriptions of various elements here, which the working group, which I'm going to come on to, key people, funding, reports, and the roadmap. So you can find all of these things on the website. Again, what you will see is some key bits of information on this landing page for TB, which is the WOA bovine tuberculosis approach, DISCON tools, which you will hear a lot more from Johannes in the next webinar in this series, and the TB Hub, which is the home of UK TB information. So looking at the research roadmaps and gap analyses, so we've got candidate vaccines, disease control and diagnostics. And as you'll see, for TB, it's a very good example of how these roadmaps interact. So the example that I'm going to show you is coming from a report of a workshop that was held in the UK in February 23, which talks about research gaps, which I'll come on to. But at this point, I would just like to thank the key people that were involved in this. So Vivek, Adrian, James, Tom, Robin and Natalie, because they have provided a lot of input into the development of these roadmaps in light of the fact that we used to have Grab TB, that is currently not active, but the input from this workshop was very, very valuable. So in the gap analysis, which you can see from the report, again, you can go onto the STAR IDAZ website and find this report, but came up with a number of areas that would be desirable. So things that we should be aiming for. So things like better penside tests, looking at the economic case for control and how we approach that, implementing control strategies that include things like management, husbandry, treatment, and of course, better defining immune responses that would underpin a vaccine that would be better than the current approach, which is, or the current vaccine, which is BCG, and acknowledging the importance of looking at different species within domestic livestock, and again, crucially, a globally connected research community. So I'm going back to this point that I made at the start about collaboration, coordination, and integration. So in terms of the unmet needs, so these were summarised in this priority and executive summary of the priority research needs for bovine TB. This was published again by STAR IDAZ in May 2024. And looking at vaccines in particular, it was about developing vaccines that reduce transmission and crucially would allow differentiation between vaccinated and infected cattle, and also about validating the efficacy of BCG for immediate deployment and as a baseline for future vaccines. So when I talked earlier about unmet needs and thinking about that TPP, what do we have at the moment? What can we use? What can be used until something better can be developed? So it's all about applying our current knowledge in the most effective way possible to get to the goals that we want. So this is the roadmap, a schematic for the roadmap for a candidate vaccine for bovine TB. And what you'll see is that, so this is the interactive roadmap on the STAR IDAZ website, and it looks different, much nicer visually than the schematic that I showed earlier for the generic vaccine. But essentially, this is the same structure with these different numbers, the different nodes, and these all interlink. When you go on, and this is an interactive roadmap, these dependencies will highlight up so that you can then go back and look through the areas of research and find out what do we know, but what don't we know? And of course, these are the things that are important for funders. They're also important for researchers, because this helps you in terms of framing a grant proposal. What gaps do you need to be addressing that are going to get you to that point? And I mentioned about the nodes. So this is just if we pick number 3, which is rationally attenuated vaccines. So in terms of what a vaccine that allows DIVA, what's the research question? The development of a vaccine that gives better protection than BCG, but allows the differentiation between infected and vaccinated animals. And in this regard, this is where we need to be looking not just at the roadmap for vaccine development, but also for diagnostic tests and disease control. And again, referring back to the UK TB Hub, if you have a look at that, you'll see the approaches that are currently being taken with the new diagnostic test that's being assessed that can help differentiate between vaccinated and infected animals, and then ultimately, of course, the deployment of BCG, which has been problematic until now because we couldn't do that differentiation. So again, research gaps and challenges, things like what strain of organism would be used for this attenuated vaccine, the solution routes, establishing immune responses to that modified attenuated organism. How does it compare to BCG? How does it compare to responses to M. bovis? And dependencies, the generation of these organisms where the genes for virulence factors have been removed, and the state of the art. What is the existing knowledge, including successes and failures? And this does go back to the research community very largely. Successes, we can find successes usually through publication, but they might not be timely because publications will come out quite long after the research has been conducted. So this is where communication becomes really important. Failures, much harder to find, because sometimes, in fact, often failures may not end up in publications. And particularly when animal experiments have been used, this is, I think, a shortcoming of us in terms of our research community, because if these are highly controlled experiments with a good hypothesis, even if they didn't work, it's important that we do, and when I say work, don't deliver a vaccine, it's important they are published, because the controlled data will give us that information. So when we think about return of investment, I think it's worthwhile in saying we all own it. I mentioned this at the start. So this isn't just about funders, it's about the research community. We have a responsibility to each other. We have very limited research funds. STAR IDAZ International Research Consortium is looking, the executive committee do look to deploy those funds in the most effective way possible. So If you do have information in any of the priority diseases, you're linked into STAR IDAZ, please do go onto the website, tell us about your project, and keep us up to date. So just to summarise that, and I think I'm coming bang on towards the end of my presentation time, the STAR IDAZ roadmaps, hopefully I've showed you, provide a framework for strategic collaborative research for the benefits of One Health, which is a key underlying principle of STAR IDAZ. Taking an informed approach towards designing the TPP at a very early stage accelerates progress because it tells us about where we want to go, what the gaps are, and how we then deploy the research funds appropriately for the deployable vaccine ultimately. And community input is really important for getting the information on the state of the art for the research roadmaps to identify those gaps, reduce the duplication of effort, and maximise the return of investment for our global research funds. So with that, I would like to thank you for your attention. You can get more information on STAR IDAZ from the STAR IDAZ website. I would like to thank all of the CIRCA members, STAR IDAZ IRC Executive Committee and Scientific Committee for the support that they give us over many years. CIRCA 2 is funded by the Horizon Europe programme and by UKRI Horizon Europe funding. So thank you for that, and happy to take questions. Over to you, Latifa.
Thank you, Gary. Thank you for being sharp on time. That's very appreciated. And thanks a lot for this very helpful presentation to see how the roadmaps, TPPs and coordinated efforts all come together. And thank you very much for this excellent slides. As you said, now we move to the Q&A section. I call all our attendees to feel free to send your questions through the window Q&A box. And Jeremy, please also feel free to jump in during the discussion.
Latifa, can I just confirm that my screen stopped sharing just so that I'm aware for your purposes?
Yes, it stopped.
Great, thank you.
Thanks. So I don't see again questions while we wait for this. I'd like to start and to open the discussion with one question that might be important for everyone's understanding. How do the roadmaps relate to vaccine commercialization with regard to what was presented with your slides, Gary?
Yeah, so as I sort of mentioned, this is hopefully it did come across that these are predominantly research roadmaps, and they are about establishing the scientific principles that we talked about within each of these nodes that then take us towards that deployable vaccine. And again, I would go back to the importance of defining the TPP, but engaging with industry at a very early stage so that we can take an informed approach to the research that we conduct, because I think that's very important. There are a number of other elements that come into play beyond the research roadmap itself. So things like the regulatory processes and a number of other elements, which I think in terms of science, we're probably not that good at. And I would say as researchers, we often focus on the scientific detail, which is great and it's really important. But I think this is where having multiple inputs into vaccine design and into using that roadmap as a framework very, very important. And Jeremy, if you've got anything that I think from your perspective that you would like to add to that, it would be, I think, useful, because you do have a wider, more commercial perspective than I do.
Yeah, and I think the other potential users, people who might find it very useful to go into the roadmaps and have a look, would be potentially commercial partners who would be looking for state of the art. I mean, the sort of information that we try to capture within the nodes that you've mentioned already, Gary. So I think if you're a commercial company interested in getting involved in an area and you don't know the research community that's involved in that, then the roadmap is a really nice way of doing that, because there are various pieces of information within the nodes around the state of the art. The people, you can look in there and see what are the current funded programs that STAR IDAZ is aware of that are listed there. You can see who the people are who are working, and it gives you a way of getting into that aspect. And in addition to that, I think the reports that STAR IDAZ produces are also very useful from that point of view, because they're summarizing all of these areas. And again, from a commercial company point of view, if you wanted to look for connections, find out what's going on, then those reports, if they're available, like the one that you mentioned for TP, that's a good example. Yeah, it's another nice output from STAR IDAZ that can help that whole commercialization.
Yeah, very helpful. Thank you, Jeremy. I will take the question from Lizelle. Lizelle question is, does STAR IDAZ actively seek out research projects in the disease you are looking at, or do you rely entirely on the community to inform you?
Okay, Latifa, you can probably answer that question as well if you want to chip in from the STAR IDAZ perspective. So the community and the working groups, which I think I could have probably talked a little bit more about, but the working groups will feed into what those gaps are. And those gaps that are really important in terms of directing the funding to the most effective areas. So there will be a number of elements that go into identifying the gaps, and then that information comes to the scientific committee. The scientific committee would then make recommendations to the executive committee. The executive committee is combined of funders, and those funders, what the vision is within STAR IDAZ is that those funders can then share that information. They can share the knowledge, the priorities, which may differ for different funders. And I think this is obviously, I mentioned about the regional networks, and there are priorities that might be different across different regions, which therefore means there'll be different priorities for different funders. So it is quite a kind of complex set of interactions. But I think the key thing that I would say that underpins it is an informed knowledge base that comes from experts in the field with those working groups that are put together. So I mentioned a number of people for TB, but that workshop did involve a large number of people, which did include individuals from industry, it included individuals from STAR IDAZ, and that report came out, which again Jeremy mentioned, but it's very valuable for people in the industry, it's valuable for scientists. It helps direct the research investment. So does that answer the question? Is there anything, Latifa or Jeremy, that you would want to add to that?
Yeah, for me, it's fine. You explained it very well. Thank you, Gary. We move to the next question. It's from Karine Dupré. How can roadmaps help funders to make strategic investments?
So again, I think hopefully I've kind of answered that in the previous question, but it's about those gaps. And when you go into the nodes, identifying the gaps, what is the state of the art? Jeremy's mentioned this as well. What do we know? What do we not know? And therefore, what do we need to do? What research do we need to conduct to address that gap? And then that takes us further along that pipeline towards getting the goal that we're looking for. So that target product profile, or whatever, or the knowledge, or whatever that multifaceted tool is that we're taking for disease control. So it is about identifying those gaps. As I said, this is where knowledge is really important. I think I would refer people back to the One Health report. I found that really interesting, just about how do we capture One Health. Again, it's a phrase that I think means different things to different people, and that kind of complicates even how we collect our knowledge, what activities are ongoing in that area, which then complicates how we identify the gaps. I've actually found that a very useful report, and I thought that graphic of all the different funders that combine, even at a national level, it shows you the complexity of that. When you go international, you've got an even additional layer of complexity. So the roadmaps do help us, I think, as a tool for focusing our research.
And the other thing, the other thing I would say, Gary, is all of this goes up to the executive committee, and in my mind, this is a unique opportunity for people to present what they're doing. So there's another question that we've been asked about, do you go out and look for projects, or are you relying on people to put them in there? I would say, please, if you're working one of these areas, put your project there and make it visible, because then it will feed up to the executive committee. And this is that group of funders is almost unique in terms of being members of the executive committee and being able to talk to each other and see what everybody else is thinking in that area of where do we focus. We're agreed that the working groups have come up with these ideas. Those decision makers are then made aware of where those gaps are. They can see who's working on them. So everything that we do with the roadmap goes up for approval by the executive committee. So everything in there is very visible to the big funding organizations around the world. Many organizations are there who are putting money into global research in animal health, and there aren't that many. So it's a really nice opportunity to actually get your issues in front of that group of people.
Latifa, if I could maybe just add to that. So Jeremy, that's a great point. And I think, again, if I can just emphasize the importance of having a voice within the scientific community. I think sometimes people feel that scientists, they don't have a voice, they're kind of dictated to. STAR IDAZ does provide this opportunity for people to communicate back to us. And there are quite a lot of surveys that come out. So for example, that diagnostics report, I can't remember how many people were approached, Latifa. I know it was multi-sectorial across the globe, but it was over 60, I think. And the response rate was pretty low. It was under 30%. So, what I would always say is, if you get the opportunity to provide input into one of these surveys, please do so, because it does go up and we do see the impact. And I think the way that veterinary vaccinology research has been supported through those landscape surveys, how the networks have evolved, has been very much, STAR IDAZ has been pretty central in that process going back over 10 years. So yeah, as a member of the research community, if you're asked for your opinion, I would say give it.
And the other thing I just mentioned as well, we have a question there, and maybe we can answer that a little bit as well, Latifa, from funding agencies that might ask particular questions related to the outputs from STAR IDAZ. Please remember, BBSRC and the European Commission now put it's routine to have a statement in there asking applicants to make sure that they're applying for something in line with STAR IDAZ priority objectives. So it does have an impact. The output from STAR IDAZ certainly has an impact directly on the funding for BBSRC and the European Commission. And I'm not aware of any others, but there may be others as well.
Thank you, Gary and Jeremy. I hope that respond very well to Caroline's question, and we can take another question. I think time still allow it. This This next question is from Marina Bagni, our colleague. Do you think that the roadmap can be used as a self-tool of evaluation to check the quality and the horizon of the research at national level program?
So again, this goes back to the information that's in that roadmap. I'm kind of not 100% sure of the question, if it's relating to things that are already being funded at a national level by multiple funders. I think is that maybe what the question is. It's about capturing the state of the art. And again, if that is the question, that is still a challenge. I would refer back to the graphic that was in the One Health report. And even at national level, there are multiple funders. So there will be government funders, there'll be industry funding some research, there'll be organisations, there'll be research institutes conducting research, there'll be universities conducting research. It can be that is still quite a difficult thing to capture because there is no single body. But the roadmap does provide that framework. If we can get all of that information in, is what I would say. I don't know if that answers the question. Jeremy, did you have any other points to that?
Yeah, I think that's good. I wasn't quite sure of the intent of the question, but I think that's a good answer either way.
I also confirm Gary's response to that question. I'm not sure we have another question or a comment from Dr. Margaret Nolan. Are you aware of any funding call that requires an answer to the following type of question in their application process? Who did you consult, animal production industry or manufacturing industry, to assist in defining the TPP for the species or disease you are researching a vaccine for?
So I'm not aware of that specific question being or asked in that way, but it is kind of asked by funders for, I think when we think about things like the TRLs and Horizon, the collaborative projects on Horizon 2020 funding, you would be expected to show that you've got a knowledge of that. You would have probably, as you go up those numbers, an industrial partner involved anyway. And most funders will assess potential impact of a proposal. And, I think, as I said, defining the TPP can sometimes make scientists nervous, and I kind of get it, because you can feel that you're setting yourself up for failure. But it's about what's the impact of the research that you're doing, and the impact might actually be knowledge, but leading ultimately to a product. If you're quite far down that research roadmap, in terms of you're quite far away from what the ultimate TPP would be, I think that question is less likely to be asked. The further or the closer you are, the more likely it is likely to be asked by a funder. But so I'm thinking mainly about things like if you were doing basic immunology and looking at perhaps immune protection, immune correlates, that sort of thing. But ultimately, I think it's something that it would not help you. It wouldn't harm you to have a very clear direction in a funding proposal as to ultimately where that research is going for impact. Jeremy, what's your perspective?
Yeah, I'm not aware of a funding call that specifically asks you for the origin of the TPP. But what I would say is, for people who are familiar with UK funding, government funding, I think it would be, for me, it's a difference between the basic research council funding, so BBSRC, MRC, etc., and then Innovate UK. And Innovate UK is further down that development pathway. And within if anybody's familiar with an Innovate UK application, there is a section there specifically around market awareness, and it is possible to include information around a target product profile. What is the market you're actually aiming for? And you can therefore mention what the origin of your information is, basically. So it's not exactly the question that was asked, but I think that's an example where a more translational funding application you could put something in there. And related to that, Latif, sorry if I could, I think Natalie van der Hayden had put a question in the other chat about are the roadmaps reviewed by industry? I would say the working groups can have industry members. There's nothing to stop that happening. And there are industry members at the executive committee level as well, which is ultimately the approver of anything that the scientific committee pushes up before it gets published by STAR IDAZ. So there are opportunities there for industry to have inputs into the roadmaps as well.
Yeah, good point, Jeremy.
Thank you, Jeremy. We are reaching the end of our session, but still one question from Natalie. Are the roadmaps, if we can, of course, reply quickly and briefly to this one, are the roadmaps reviewed by the industry?
That's the one I just answered, Latifa.
Yeah, that's just been answered. Latifa, you're muted.
Okay, then there is no other question. Thank you very much, Gary and Jeremy, for supporting the discussion. And a big thank you, of course, to all of you for attending and for your active participation. I still see some those are coming. This webinar is the first session, as I said, of the STAR IDAZ Innovation Academy, and we warmly invite you to join the coming sessions on 3 December and the third one on 17th December. The recording of today's session and the slides where possible will be shared shortly. Many thanks as well to Hannah for her support in organizing today's session. And thank you all and have a great afternoon or evening. Thank you. Bye.
Thank you.